Hello and welcome to today's class where we're going to talk about strengthening the pelvic floor. My name is Dr. Brigitte Rossi, and this is a topic that is so important for people to know, especially us as women. If you've gone through childbirth or if you have just had a lot of activity in your life, all kinds of things, this is going to be for you. Now, it is a subject that isn't talked about widely out there. There is more and more information coming out all the time, but this is going to be so resourceful for you to know about your body and how to properly support it. Now, with any transformation that we do, keep in mind it's a workout. Your time and your body, and so you're going to own it. And some days are going to be more challenging than others, but keep your goals in mind, okay? And that will keep you motivated to continue to work at this and create some success for yourself. Now, first of all, before I get started into talking about the exercises that you can do to support your body, I want to talk about what is the pelvic floor, all right? So we're going to go into a little bit of anatomy. The pelvic floor is made up of different supportive muscles, tendons, and ligaments at the base of your pelvis. Now, these muscles can stretch just kind of like a trampoline from the tailbone to the pubic bone. So even though the pelvic floor is hidden from view, it can be consciously controlled. And therefore, if you can control it, you can train it and you can strengthen it, just like you do your abs and your legs and your arms. All right. Now, the pelvic floor is what it supports the function of the bladder, the uterus, the vagina, the rectum. All of these things obviously are so important to our body, and we use them every single day. So we want to not just strengthen those muscles, but also it's going to help support those organs and our lower abdominal cavity. Okay, now this is both for men and women. It's also going to help support sexual function in both men and women as well. All right, now why do we even need to do this? Doesn't it just stay strong? Don't we just always, right, use them and therefore we don't have a problem? No. Now there are a number of factors that can weaken or loosen the pelvic floor. Some of these more common ones that you may know about is childbirth. Right? For men, things could be like a prostatic cancer surgery, anything where you're going in there and it's going to affect those muscles. Also, if you have bladder or bowel problems, constipation, if you do a lot of heavy lifting, those are also things that can cause some relaxation of those muscles. Now, things like pregnancy, childbirth, right? If you're straining, coughing a lot, heavy lifting, impacted exercise, age, and obesity, in most cases, it's possible to tighten your pelvic floor muscles and regain that control. All right, so let's go and take a closer look. See if this will help support you. During pregnancy and childbirth, the pelvic floor muscles get stretched out. Now, I have had 3 children. I had never even thought of pelvic floor muscles until I started having more and more children, and then realizing, wait a second, things aren't like before, and really having to consciously work at strengthening those back out. So it can be from the weight of the baby, if you've had heavy babies like me, or maybe just your hormones that you have in childbirth that are made to loosen the tissues. There's also the efforts of labor, right? Your muscles don't stand a chance against all of these factors. So when we have severely weakened pelvic muscles, usually following several pregnancies, it can cause your pelvic organs to even slip down in your pelvis. So that can be called organ prolapse, and we want to avoid this happening. So when we have prolapse, it can give you a real dragging feeling in your vagina because the womb or your bowel and your bladder are pushing against the walls of the vagina. So these conditions are more likely to happen later in life, but that's what we want to prevent. So rather than waiting till later, till we have issues, we can do this right after birth. Okay, so doing pelvic floor exercises after birth can help prevent and treat that stress incontinence that women tend to get. Also improving the circulation of blood to your perineum, which will help reduce any swelling or bruising that can happen, and rebuild the strength of your pelvic floor. Remember, everyone is different. So you're going to want to check with your healthcare professional to decide how soon after birth or labor your body is ready to begin strengthening these strengthening exercises. So we have, when we are repeatedly straining, right? We talked about that. When you're repeatedly straining your pelvic floor muscles, either from the bathroom, from coughing, heavy lifting, high impact exercises, that can create pressure, constant pressure over the pelvic floor, and ultimately lead to that prolapse as well. So whether it's from the gym or job specific tasks, it's important to also perform proper techniques to protect your body. All right. Additional causes of the pelvic floor can be also aggravated by obesity, because in obesity we have weakened muscles, and in general it's going to be with older age, but the pelvic floor exercises can be done at any age, absolutely any age. Anytime you after you've given childbirth, it is absolutely recommended. And it can improve, though, if you haven't done it, you didn't know this information when you had kids, and now you're older and you're taking care of your grandkids, that's okay. It's not too late to start doing these exercises to support your body and your pelvic floor. So before we get to the actual exercises, let's review a few things. Some of the benefits of strengthening your pelvic floor are going to be increased sexual sensation and orgasmic potential. That's a beautiful thing. Increased social confidence and quality of life. Improved bladder and bowel control. Absolutely. Who wants that? We all want that. Improved recovery from childbirth and any gynecological surgeries. It's going to help improve recovery after a prostate surgery, as well as reduce your risk for prolapse later in life. So in order to start training your pelvic floor muscles, we've got to understand where they are. So have you heard of a Kegel? Kegels is when you consciously draw your pelvic floor in. And you may feel familiar if you've ever done a pelvic floor workout. Okay, so to do a Kegel, you're going to start by lying down in your back with your knees bent and your feet on the floor. Squeeze and lift your rectal and vaginal areas. And as you are as if you're trying to stop yourself from urinating, okay? So kind of like you're holding that in so you don't have an accident. That's what you want to do. You're going to squeeze in that area, okay? You should feel a little bit of a squeeze. Now you want to hold that for 5 to 10 seconds, like I said, okay? And then relax. It's important to be able to hold that, and then your time holding it is going to increase. You don't want to just contract and relax. That's not what we're going for here, okay? You want to actually squeeze and hold. So practice doing that for 5 reps, okay? Now this is the muscle you want to squeeze when you're doing different pelvic floor exercises. The first exercise I want to bring to you is the bridge pose. The bridge exercise helps strengthen the pelvic floor, your core, and your hamstrings. Remember, our whole body works together. So this is not just about our pelvic floor, and it's not just about our core. They are all important, that they all work together. So to do the bridge pose, you're going to start by lying down with your knees bent and your feet on the floor. Place your arms down alongside your body with your palms facing down. Now, engage your pelvic floor. Inhale to lift your hips up toward the ceiling. Hold it for 20 seconds. Then exhale and release your hips back down. All right, repeat that 3 reps. and that is the bridge pose. Very simple to do. Everybody can do it, and you will find yourself getting stronger and stronger every time. The second one I want to do is the shifting plank. Now you may be familiar with a standard plank. We're going to talk about shifting our weight through this plank back and forth, okay? So this is going to help support our pelvic floor as well, again, as our strengthening our core muscles. So you're going to start by lying down on the floor on your belly, and then prop yourself up onto your forearms. Straight, make sure your legs are straight, okay? And you're on your toes. Come onto a forearm plank. So you're going to put your forearms down on the ground. Still your legs are straight, okay? And you're on your toes. Now, as you're in this position, draw your navel up to engage that pelvic floor. Your shoulders should be stacked over your elbows, and your hips should be in line with your shoulders. While in the plank, inhale to shift your shoulders in front of your elbows, coming high onto the balls of your feet. And then exhale and shift your shoulders back over your elbows, pressing your heels back. So you're rocking forward and back, kind of onto your tippy toes and back into neutral position. Repeat that 15 times. That is your shifting plank. The next exercise is called the dreaded wall sit. You may be very familiar from wall sits from maybe from school, when you went to elementary, high school. I know I just did this with my daughter the other day for an elementary school exercise, and we were doing the wall sit. The wall sit can actually truly help strengthen your pelvic floor, your core, and your legs. So stand facing away from a wall. Put your back against the wall, and then walk your feet out in front of you so that the wall is actually supporting you. Bend your knees until they are to 90-degree angle. Okay, make sure that your ankles and your knees are one on top of each other, and that your knees don't go in front of your ankles. Bend your knees until they're 90 degrees. Now engage your pelvic floor. You do that by kind of drawing up your navel, your belly button. Kind of draw that up, and that's going to contract your pelvic floor muscles and flatten your spine so that your lower back is pressing into the wall. Now reach your arms out and straight in front of you and hold that for 60 seconds and then release. Well done. Next one we're going to do is the split tabletop. Anyone know this one? It's great, again, for strengthening your pelvic floor and your core. So start by lying down with your knees bent and your feet on the floor. Place your arms alongside your body with your palms facing down. Engage your pelvic floor and lift your feet off the ground, okay? Now, parallel your shins to the ground so that your knees are at a 90-degree angle. Keep your knees at that 90-degree angle and inhale to separate your thighs into a straddle position. As you exhale, squeeze your thighs back together and contract your pelvic floor. All right? Repeat this for 15 times. Where you inhale, separate the thighs into a straddle. Exhale, bring them back together and contract your pelvic floor. Next exercise that's wonderful is the tabletop pelvic tilts. The tabletop pelvic tilts will help you to strengthen your pelvic floor by starting on your hands and knees like a tabletop, like as if you are the table in the living room, okay? Make sure that your shoulders are stacked over your wrists and your hips are over your knees. When you inhale, round your low back and it tilts your tailbone down. At the same time, tuck your chin and draw your navel up and in. This will help and focus on contracting your pelvic floor muscles. Now exhale and go back to center. Inhale, round your lower back, tilt your tailbone down, tuck your chin, draw your navel up, and contract your pelvic floor. Exhale, come back to center. Now repeat that 15 reps. You may be very familiar with the bird dog exercise. That is the next exercise we're going to go through. Again, wonderful for our core and helps improve balance and coordination as well. Anytime we're involving more muscles, the better it is for our overall body. So the bird dog exercise, again, you're going to start in that tabletop position on your hands and knees. Now engage your pelvic floor and shift your weight onto your left hand and your right knee. So you have opposite hand and knee. Then inhale to reach your right arm forward and your left leg back. Pause just a moment and exhale, placing your right hand and your left knee back down to the starting position. Now shift your weight onto your right hand and your left knee. So opposite hand, opposite knee. Inhale and reach your left arm forward and your right leg back. Pause just a moment and then exhale and place them back down. So continue alternating hands and knees for 12 reps. This is the bird dog. As you can see, these are all very simple exercises. They don't take a lot of time and you will strengthen over time. The next one is the stop, drop, dead bug. Have you ever heard of the dead bug exercise? It's such a funny name, but amazingly efficient for our core and pelvis. So to do this one, lie down on your knees, with your knees bent and your heels on the floor, okay? So you are on your back, knees bent and heels on the floor. Extend your arms back behind your head and engage your pelvic floor. Now, on an exhale, draw your knees into your chest and crunch your shoulders up off the ground. Then reach towards your toes as you contract your pelvic floor. So it's a little bit like a ab crunch, right? But was slightly different, and you want to focus on your pelvic floor. So inhale, lower your arms, put your heels back to the starting position. And again, you're going to, on an exhale, draw your knees into your chest, crunch your shoulders up off the ground, and reach towards your toes to contract the pelvic floor. So you repeat this 15 times. On top of these exercises, all these exercises are great to do daily or at minimum a few times a week. On top of what you do to strengthen your pelvic floor, you really want to perfect your posture. Strengthening your pelvic floor can help improve your joints, your low back, and your hip pain, but the best way is also to proper alignment of your spine and posture. So honestly, this can be the most challenging, not hardest, but most challenging exercise, but extremely beneficial. Having proper alignment and placing that pelvis at the best angle will help support your entire abdominal muscles and your pelvic floor. So it'll make it easier to strengthen naturally. So the way we want to stand correctly, okay, and you can talk to your chiropractor about this as well, but you want to bear your weight primarily on the balls of your feet. Keep your knees slightly bent. Don't lock your knees, okay? Have a little bit of give in there. Then keep your feet about shoulder width apart. Let your arms hang down naturally down to the side of your body and stand straight and tall with your shoulders pulled backward. Tuck your stomach in. Now, I'm not saying suck your stomach in. No, tuck it. Just kind of like give your hips just a little tuck in where you're bringing your pelvis forward a little bit, okay? And keep your head level, and your earlobes, you should find them in line with your shoulders. Don't push your head forward or backwards or to the side. Just keep it natural. When you shift your weight from your toes to your heels or one foot or the other, that will help you when you're standing for a long time. Just shifting your weight. When you're standing there, primarily you want to be on the balls of your feet. All right, so we want to also maintain posture when we're sitting. To do this, place your feet flat on the floor. Now allow a small gap between the back of your knees and the front of your seat, all right? And your knees should be at or below the level of your hips. Relax your shoulders and keep your forearms parallel to the ground. Avoid sitting in the same position for long periods of time. It's great to even set an alarm so that you're getting up and moving around as often as possible to re-engage all of your other muscles. Because when we sit too long, they tend to fall asleep. We want to engage those muscles. Now, your head alignment is crucial to posture. One of the more common hindrances of posture, proper posture, is forward head posture. When the head is misaligned, the rest of the body follows, right? Those with forward head posture are more likely to have pelvic floor issues. Who would have thought? But it does. The top and the bottom, as if you had a string and you're holding a string. If you affect one, it affects the other side too, right? It affects the alignment. So check your alignment. Get your chiropractor to check your alignment. You can also have somebody take a side view of you. Now make sure you're standing naturally for the photo. If you're all setting yourself up and correcting your posture, then that's going to give you a false sense of your alignment. So your ears should line up with your shoulders to your hips, knees, and ankles, all one stacked upon the other. Tuck your chin in slightly, and that will help lengthen the muscles in the back of your neck and actually help your pelvic floor. Isn't that amazing? I love how everything is so connected. Now, the biggest posture mistakes that can hinder your pelvic floor strength actually includes clenching your glutes or having a large anterior pelvic tilt. So if you're like kind of sticking your butt out, that can actually hinder your pelvic floor. So often this is an unconscious habit, so just be aware. Check your posture and see if you are clenching your glutes or scooping your hips back, okay? This will also make it more difficult when you're sneezing to activate those pelvic floor muscles because of the way that they are in a tightened position. So the last thing I want to cover, so very important, is diaphragm work. You actually can strengthen your pelvic floor just by breathing. How amazing is that? So simple, yet so powerful. So when you are breathing, you want to expand from your diaphragm. That is going to help push the pressure down into the pelvic floor, which will naturally strengthen your pelvic muscles. So most of us we do shallow breathing from our chest. So that also encourages forward head posture. We are going to have proper posture, and I'm going to teach you how to breathe right now. Do a diaphragmatic breathing while you're sitting. So sit comfortably with your knees bent, your shoulders, head, and neck relaxed. Place a hand on your chest and the other one just below your rib cage on your belly. This will allow you to feel your diaphragm move as you breathe. So breathe slowly in through your nose and feel your stomach move out against your hand. The hand that's on your chest should barely move, okay? Now tighten your stomach muscles and let them fall inward as you exhale through pursed lips. The hand on your upper chest again should remain as still as possible. If you continue to breathe like that, push your belly out and then bring it in as you exhale, that will actually help your abdominal breathing. Your pelvic floor. You also want to make sure that you're expanding in the sides. So it's not just your belly, your whole rib cage is expanding. That means you're having a good diaphragmatic movement happening, which will help with that pressure in your pelvic floor. I'm going to post a link on a tutorial on how to also do rotating lunges with a resistance band. That's a great exercise that you can add when you're ready. So are you ready to start planking? Are you ready to do those exercises? I'm going to recap some of those exercises, okay? So the bridge, the plank, right? And we're rocking that plank back and forth, doing a wall sit, a split tabletop, tabletop pelvic tilts, the bird dog, the dead bug crunches, right? So we just covered 7 amazing exercises to help support you and your pelvic floor, along with your posture and head alignment and diaphragmatic breathing. You can change the way that your pelvic floor is functioning, and therefore regain your health and improve your health. Thank you so much for joining me today. I hope this helps you, and feel free to reach out if you have any questions. And if you feel like you need a little extra training, come find us. We will help you, and we'll see you at the next class.